I think it's important for us to know that wildfire smoke will be here. So we have to make sure that we are ready. Now, whenever we say wildfire smoke, one of the things we like to do is talk a little bit about smoke, because smoke is this thing that we only think about when we kind of see it or we smell it. And it's actually an extremely complex composition if you think about it. It has a little bit of everything from liquids to gases and particulate matter. And it has some things that we all have heard about, particularly things that do impact health, like, carbon monoxide, carbon dioxide, aldehydes, sulfur dioxide, benzene, toluene, and metals and dioxins, among other things. It has a lot of things in it. But one of the things that we do worry about a lot is small particulate matter that is 2.5 microns in average. And the reason for that is because your body is really very well equipped to filter larger particles as they come through your nose, for example, and keep those and trap those and prevent them from going into the lower respiratory tract, the lungs, and the lower part of the lungs. But the 2.5 micron particles do have the ability to traverse the respiratory system and can cause everything from irritation, inflammation, to direct damage because of the composition of some of these particles. One of the things that we talked a lot about when we were talking about viruses is smaller than a virus, is smaller than a human hair, which is 50 to 100 microns. So if you imagine the typical human hair, you can see it. This kind of particle, you can see it. And that's why I say we typically think about it when we see the smoke or smell the smoke, because we don't see the particles. And these particles can actually do significant damage to your body. And depending on your clinical condition, you can have significant issues with cardiovascular disease, pulmonary disease, and even renal failure and kidney damage, depending on what the issues are. Now, it is important to remember that these are smaller than respiratory droplets, and you see the droplets right under is 5 microns, 5 to 10 microns, which is a lot bigger than these little tiny particles. And we have to make sure that if you're going to effectively filter out the smoke for health reasons and or to prevent exposure, make sure you're wearing the appropriate mask, which in this case, and we saw that in New York City, is going to be N95, hopefully and preferably fitted N95 that fits you really well and can help you. So why do we worry about the exposure to smoke? Well, the reason why we worry about the exposure to smoke is because there are a number of people who are at a higher risk for pulmonary, cardiovascular, renal, and other issues, including inflammatory conditions. And these are the folks that need to be aware, and these are the folks that we need to be mindful in terms of exposure to wildfire smoke. Obviously, those that have pre-existing respiratory and or cardiovascular disease, you're increasing the burden to the heart and you're increasing the burden to the lungs, which makes it more difficult to breathe and sometimes more difficult for the heart to pump blood as it goes into peripheral vasodilation. So make sure that if you have respiratory, whether it's chronic obstructive pulmonary disease, asthma, or any other condition that could potentially be impacted by a decreased lung capacity, talk to your doctor, make sure that you know exactly what you do. And same thing for cardiovascular disease. And cardiovascular disease is a really big bucket. Is everything from severe hypertension to congestive heart failure and everything in between. So make sure that you know what your potential risk is, particularly if you're going to be in an area where there may be wildfire smoke. And in Spokane, that's going to happen sooner or later, and particularly if you're going to be outdoors. Now, pregnant women have the same issue because, as you know, pregnancy poses a significant physiologic challenge to the body. And anything that really hampers that basic balance of all these physiologic systems can cause harm to either mother and or unborn child. Those that are at the extremes of age, they're very young, as well as those that, I don't like to say old, but those that are older. I'm looking for a better word like later youth, but I have not been able to get anybody to adopt that officially. And as you know, we're living longer. And as we live longer, we also see the potential and probability of chronic illness increase. And there are a lot of older adults living with 2 or 3 pre-existing conditions, and their risk goes up higher. Now, if you're an older adult and don't have pre-existing conditions, do remember that the same rule applies to children. Your physiology doesn't have the same adaptability to environmental conditions that you have when you were younger. So be mindful, even if you're in really good health, and don't overdo it outside. Speaking of outside, we can't forget our outdoor workers. And that could be construction, agricultural, etc. These are folks that many times are out there. And we cannot forget about first responders who usually are in the line of fire, no pun intended there, when it comes to wildfire smoke. Last but not least, there are still many people in our community that don't have access to helpful resources, may not have a place to be, may not have a place where they can shelter themselves from smoke, may not have access to masks, may have clinical conditions that are partially treated or not treated. So I think we need to be mindful of that and make sure that we do take care of each other and we do keep an eye out for each other. This is one of those things, and we've talked about this with extreme heat also. If you have neighbors, friends, family, colleagues that may be at risk, let's make sure that we're all taking care of each other. And taking care of each other is usually the best way to prevent harm to those that are around us. Now, what is one of the most important things that you need to have? And sure, masks are going to be important. All of these things are going to be important. But the most important thing you can have is the knowledge. Know exactly when you should take what kind of precautions and when you should be concerned about you and those around you, particularly those that have pre-existing conditions. And that is where the air quality index comes in. And as you can tell, is actually spelled out in colors with numbers and tells you precisely when things are good, very, very nice green thumbs up, and when things are really to the level of dangerous, which is hazardous over 300, and Lisa's going to talk about that. But I think it is important that you know how to access this. Spokane Clean Air Agency. Make sure you can check their website, make sure that you know. And very importantly, do pay attention to any health alerts that may be coming through either your phone or your computer or at work or where you spend time, because we do try to make sure that the community knows when there are conditions that may not be safe. And our weather people in the various radios and TV stations does a great job of doing that too. So make sure that you have the knowledge, you know how to get the information. And if there's someone that doesn't have it, please help them out and share it with them. Make sure they know how to do it. So with that, I'm going to stop the slides and again, welcome our partner from the Spokane Regional Clean Air Agency, Lisa Woodard, who's going to share a lot of information with us, and very importantly, pay attention to what she's saying. And don't forget that you can go to their website and get the air quality index and a whole bunch of other information that is helpful. So with that, I'm going to ask Lisa to come over.
Thank you, Dr. Velasquez. You provided a great overview of the health issues related to particles. And it's definitely no surprise for those of us that live in this area that we can be affected by wildfire smoke each year. And I've got a few slides. So as we know that smoke can travel great distances, the size of the particle enables this. So as we're seeing on the eastern seaboard, we're seeing a lot of those Canadian fires transport that smoke across boundaries. So we know living here in Spokane that has happened. We get smoke from fires nearby, and we get smoke from fires that are hundreds of miles away. 8 of our last 11 summers have been affected by wildfire smoke significantly. And this next chart is a great illustration of this. Really, 2012 was the first year that we noticed air quality, or we measured air quality over the health standard due to wildfire smoke. Wildfire smoke particles have been measured since 1999. And so we went a few years, and then here we got hit in 2012. And then again, throughout the years, we have ramped up our air quality impacts from wildfire smoke. So this is something that's been happening the last several years, and I imagine is going to continue to affect our air quality over the years. So as a result of the 2012 wildfire smoke impacts, we gathered together some partners and said, let's get together and start convening and meeting and networking so that we can coordinate better our response. And we are fortunate to have a group of partners, including the Health District, the Regional Clean Air Agency, obviously, the Weather Service, the County Emergency Management, the City of Spokane Emergency Response, and then state agencies, Department of Health, Ecology, LNI, and other partners. So we get together before wildfire season, and we start meeting and collaborating and making sure that each of us are up to date on each of our agencies' roles and responsibilities, and then coordinate throughout the smoke season.